About 12.9 million people received health coverage under both Medicare and Medicaid in 2021. Medicare, Medicaid enrollees, known as dual-eligible individuals, are a diverse group, with nearly 40% being under the age of 65. This group of people often have limited financial means and health care needs that are more wide-ranging and complex than the average Medicare enrollee. Joining us today is Kathleen Donnelly. Kathleen specializes in Medicare supplements, Medicare Advantage plans, and special needs plans, and that's what we're going to concentrate on. Kathleen, those folks that are in that situation of maybe Medicare, Medicaid, they have a chronic situation. So how do you help folks coming in and looking at different plans?
Well, first, thanks for having me today. So when I am sitting across the table from someone that may qualify for a dual special need plan, first thing I have to do is find out if they in fact are qualified. So I ask them a series of questions. There's an income and an asset test. If their income is below a certain amount and their assets are below a certain amount, then they can qualify. If they're not already qualified, then we have to move forward to get the application through the state of Florida. There's something called the Medicare Savings Plan, and then there's something called the Medicaid for the age blind and disabled. Most people start with for those that are through the disability, they start with the age blind and disabled, and then they move into Medicare. They don't know that they need to sign up for the Medicare Savings Plan, and I can assist on that. It's important for someone who has limited assets and limited income to get the best care that they can, which means getting the most benefits that are available to them. A lot of people don't know what is available.
Well, that's it, because we were talking off camera. I was kind of basically, knowledgeable about there were other plans for folks, but that's why we come to folks like you, and you're not being nosy, you're just asking questions about their health situation, their financial situation, and if they qualify for instance, that Medicare Savings Plan.
Correct.
So somebody comes in, they sit down with you, and then how do they qualify? Is it something you can do online right there with them?
Well, we do an application through the state of Florida's Access website. But I ask them questions. I want to know what their income is, their assets. We don't want to do an application when it's not necessary. I find out where they stand, and usually I can tell when someone's like, if I tell them they have a copay of $10 and they flinch, well, $10 is too much, then let's start talking about how things are working for you. Another thing that I found out, people are living a lot longer and they're going through their money. So you might have been very comfortable in your retirement between 65 and 75, but now that you're 80, you're running out of funds. And so now that's a good time to get you on the Medicare Savings Program and give you some relief so you can have access to care.
Right.
You don't want to worry about your money while you need access to care. You just want to worry about getting better.
Exactly, and that's where you can explain these different programs. Now, what's a benefit of being in one of these dual special needs? Get the terminology, a dual special needs
Yes,
plan.
To be in a dual special needs plan, you have to be deemed dual eligible. So one of the benefits is that there's no cost sharing. In other words, you don't have to pay copays. Your benefits are covered by Medicare and by the state of Florida. It assists in your access to your copays, so it eliminates your copays. A lot of plans will get you on a Medicare Advantage plan. You don't want to go to MedSup if you're dual. You go onto a Medicare Advantage plan, and a lot of the Medicare Advantage plans eliminate any costs for your drugs. Drugs can get very costly. It also provides some additional benefits, which can change every year. More dental care, more vision care than your typical Medicare Advantage program. Maybe some gym membership, go work out.
Oh, and is this where folks sometimes will say they're getting a grocery supplement?
Yes.
They'll get a card for
Yes.
groceries or just basic first aid items, things like that.
Some of the Medicare Advantage plans do offer what we call OTC, over-the-counter benefits, where you can get aspirins, Tylenols, vitamins, compression socks, There is some grocery benefit also. You can get healthy foods like fruits. Can't get alcohol or cigarettes, but you can get healthy fruits, vegetables, meats, things that sustain you, and even some of them will help pay with utilities and cable, so you can keep your lights on.
So, so actually, as we try to navigate that system called Medicare, Medicaid plans, we come to folks like you, Kathleen.
Yes,
and you make it
please.
simple, you make it easy. So thanks again for the information. Anything final?
Well, everybody has different needs. So it's important that you find the right plan that works for you. So it's very important, in my opinion, that you deal with an agent, a local agent in your area, such as myself and my colleagues, because we can sit down and talk with someone and find out exactly what it is that you need and find the plan that's right for you.
And thanks again. Great information. We certainly have learned a lot about these dual eligible special needs plans. So if you'd like to find out if you are eligible for one of these plans, reach out to Kathleen with the information on the screen. Thank you again for being here.
Well, thank you for having me.